Hey everybody, I want to address a large grouping of antipsychotic medication side effects and psychotropic medication side effects in general called extrapyramidal symptoms, or EPS. These are drug-induced movement disorders primarily caused by antipsychotic medications. They lead to difficulty with muscle control and coordination, involuntary movements, stiffness, and tremors. They are a neurological side effect, particularly with dopamine blocking drugs like the first generation antipsychotics, and to a lesser extent, the second generation antipsychotics. So these symptoms can include dystonia, which is a sudden involuntary muscle contraction causing abnormal postures. Akathisia, which is restlessness and an urge to move constantly. Parkinsonianism, which are symptoms resembling Parkinson's disease, such as tremors, stiffness, and slow movements. And then tardive dyskinesia, which are involuntary repetitive movements, typically of the face and tongue. And if you want more information about tardive dyskinesia, see my video wholly exclusively done for that in particular side effect. So how is EPS diagnosed? So healthcare providers use clinical evaluation, patient history, and they use assessment tools. One in particular is the AIMS, or Abnormal Involuntary Movement Scale, or the Simpson-Angus scale. These help quantify symptom severity. And they also look at medication history and other neurological conditions that could be causing it. So there are medications that are used to treat EPS. They can include anticholinergic drugs like benzotropine and to help reduce muscle stiffness and tremors. Beta blockers like propranolol to treat the akathisia. Benzodiazepines like lorazepam for muscle relaxation. And VMAT2 inhibitors for the tardive dyskinesia, which are the valbenazine and deuterbenzine. So long-term effects of having EPS, if untreated, like tardive dyskinesia, they can become irreversible. Chronic movement disorders may lead to physical discomfort, social stigma, and emotional distress. Patients on long-term antipsychotic therapy require regular monitoring to prevent severe complications. The impact on someone's daily life if they do have EPS symptoms, the motor impairments may interfere with daily tasks such as writing, eating, walking. Social interactions may be affected because of the visible symptoms, leading to embarrassment or isolation. And timely intervention and proper medication adjustments can help these individuals with these challenges and hopefully make their quality of life better. So, extrapyramidal symptoms are serious side effects of certain medications. They can impact physical function, well-being, and early recognition, proper treatment, and regular monitoring by a healthcare provider is crucial to minimize the long-term effects. And if any patient is experiencing these, they need to be able to speak up to their provider, and the provider is going to be doing these AIMS assessment scales, things like that, at every medication checkup, every visit, just to make sure they can catch any abnormal movements early. So please see my tardive dyskinesia video if you're interested in learning more about that, and like, share, and follow to keep seeing my videos. See you next time.